Journal. Now with a report on treatments for stroke. Here's our reporter Laura Windsor.
Over 750,000 strokes are suffered by Americans each year. Knowing what the warning signs are can save your life, and many treatments can be given to reduce and even eliminate the effects of a stroke. Doctors David Brown and Michael Brant Zawadzki of Hoag Memorial Hospital Presbyterian in Newport Beach discussed their stroke unit and the immediate interventions administered to patients experiencing a stroke.
Well, there are about 750,000 strokes in the U.S. every year, which makes it the third leading cause of death in the United States, second leading cause of death worldwide. But it's actually the most important thing is that it's the most common cause of long-term disability. And of course we can really impact that if patients get to the hospital quickly so we can give them the newest, most innovative treatments for that stroke. There's some therapies we can only give within the first few hours of stroke. There's one thing called IV TPA, which is tissue plasminogen activator, and we can only give that out to about 3 hours. Whereas we have other newer approaches where they actually take a catheter and bring it up to the area of obstruction and can either pull out the clot or dissolve it using medications, and that can be done out to 8 hours. At Hoag, we have a very comprehensive stroke center that can deliver all these therapies 24 hours a day, and unfortunately other institutions you receive less of an evaluation. So that's why it's very important to go to a center that's comprehensive and specializing in stroke.
We asked Dr. Brown about the Hoag Rapid Response Stroke Team.
At the intensive care unit here at Hoag, we have a high specialization in the neurosciences. We have neurohospitalists who work there. We have 24-hour ICU doctors. We have 24-hour medical specialists who are hospitalists who are available at all times to respond to emergencies. And we have the ability to treat advanced neurological diseases with neurosurgery, invasive types of monitoring if that's appropriate. We have something called the Arctic Sun, which we can actually cool patients to achieve normothermia or normal temperatures in the context of having a fever and neurological disease. So these are some of the ways that we're working with the ICU to provide good care.
Well, comprehensive stroke centers really are integrators of multiple disciplines and multiple affiliated healthcare workers, all targeted on the patient's problem. The standardized process includes not just the work in the emergency room, but a reaching out to the laboratory, the X-ray imaging staff, to be ready to accept the patient for their piece of the process, which is critical in formulating the next step, which is the appropriate treatment. The Penumbra device is the newest FDA-approved device for acute stroke treatment. Think of it as a tiny little vacuum cleaner that we snake up into the area where the dirt has clogged up, if you will, the clot has clogged up the artery, and disimpacting the clot with a little stirrer device while the vacuum is on, allowing the vacuum to suck up the clot and reopen the vessel. And so the Penumbra device is used to prevent a stroke, one that has started in its process to being a stroke but may not yet have developed, and the whole idea is to keep it from developing. So the whole idea now is to get the patient into the hospital as quickly as possible, because it's the earliest hours that are critical for preserving brain tissue, and administer the modern therapies to save as much of the brain tissue as possible, rehabilitate the patient, and return them to a functional life.